All right, let's stay with the story and speak to Professor Salim Abdul Karim, who's an epidemiologist and director at the Center for the AIDS Program of Research in South Africa, but currently joining us from New York. Prof, good evening to you and good day to you. Thank you so much for joining us. Perhaps we start with just understanding it in layman's terms. For example, the WHO saying that this constitutes a public health emergency of international concern, but does not meet the criteria of pandemic emergency. What does that mean?
A very good evening to you and all of the viewers. We, under the international health regulations, the WHO is empowered to make certain declarations, and one of the most important declarations is a public health emergency of international concern. That basically means that all countries have to now gear up. They have to report to WHO, they have to establish screening, they have to be able to diagnose the cases. So there's a whole range of things that occur. The WHO doesn't really declare pandemics. It's not part of the international health regulations, but they talk about pandemic potential. And right now, because it's restricted to 2 countries, it's not really in a position, the WHO is not really in a position to declare it anything more than a public health emergency of international concern. Now, it should be noted that this is a big problem in that we're dealing with a situation where probably the first cases were just over 4 to 6 weeks ago, and we didn't even know about any of this until last week. And the big challenge has been that because it's a new strain of Ebola, the strain is called the Bundi-Bujo strain, and this particular strain is hard to diagnose. The normal tests that we use for Ebola don't work for this strain. And so we have to use a completely different way in which we diagnose it. So the challenge is about diagnosis. There's no treatment available. There's no vaccine available. So it's dependent on public health measures to control it within the DRC and Uganda.
So, Prof, I'm listening to what you're saying, but also something that my colleague was talking about with some of the authorities then in that report from Kampala. They say that they've got systems as they responded to past outbreaks and everything is under control according to them. But then I'm listening to what you're saying about this Bundi-Bujo that you're saying we don't know about, and the diagnosis is also a problem, and this particular strain, etc. So can they still rely on past outbreak responses?
Well, they are correct in the sense that the DRC is the primary source of most of the Ebola outbreaks that we have seen. In fact, originally comes from there. So from that point of view, yes, they have a superb research center and they have done some of the best research there is on Ebola. So there's no issue from that point of view. They have the infrastructure. What's at issue is that we are now dealing with something that we don't yet know the scale of the problem. And let me explain to you why that's an issue. So far, as of this morning, the latest statistics at the Africa CDC is that there are 393 suspected cases. And there's thought to be up to about 105 deaths that have occurred from this particular outbreak. But the problem is that the lab testing is now way behind because, as I said, there's no easy test for this particular form of Ebola. So they've only undertaken about 20 tests, and of those, 8 were positive. And that's how we know we're dealing with Bundi-Bujo strain. But we don't know, the others have not been confirmed as to whether they are or are not this particular form of Ebola. So what's at issue is we don't know the full extent of the problem. But what we do know is that this particular form has led to many healthcare workers getting infected because that's how it spread. I mean, the original infection is a zoonosis. It occurs from fruit bats into humans. We think that occurred some 6, 7, maybe 8 weeks ago, and that patient came to hospital, and the first person we know of that was definitely infected with this Ebola strain was a nurse at that hospital. And that was on the 24th of April. So that's how far we need to go back. Now we need to figure out how it's spreading, who it has spread to. We've got to identify all the contacts. All of that needs the laboratory testing, and that's what's in the process of being established within the DRC.
Sure. That sounds like a mammoth task. And I just want to quote something that President Cyril Ramaphosa said in his, capacity as AU champion for pandemic prevention, preparedness and response. He says, and I quote, "Ebola does not respect borders. In a region marked by high population mobility, insecurity and humanitarian movement, the risk of regional spread is significant and demands urgent coordinated action." How worried must the region be, particularly when you think about, the fact that there are some countries right now who are on edge?
Well, I think all countries need to be vigilant, and South Africa is no different from all the other countries that have passengers coming from the DRC, have movement of South Africans going to the DRC. So that's the moment you have that kind of situation. If they're going anywhere near the Ituri province, that's always a risk. What we have to ensure is that those individuals are screened upon their return to the country, or new travelers coming in are screened, and that as soon as we identify a case, and we're pretty good at doing that, like the DRC is, we've got to ensure we limit the number of contacts, because it's very likely that we're going to see several more cases occur based on the previous outbreak that occurred in 2014. Before Ebola could be brought under control, it spread to many countries, but in each country, all their individual control efforts control the problem. And I'm pretty confident we can do the same. We just need to be vigilant, and we need to have our response up and ready and to take this on.
And when you then think about the potential impact here, for example, we think about the U.S. Embassy in Kampala saying that's not at the moment processing any visas, or it's not going to be getting into that for as long as, of course, the outbreak remains, and we don't know for how long this particular decision will then last from the U.S.'s side. But what kind of further impact can this have on such services then?
Yeah, I mean, the US is not a particularly glowing example about how to deal with public health issues right now. But as we look at what are measures that are effective, one of the measures we know that's not effective are the restriction of control, restriction and control across the borders. Closing borders or preventing people from traveling, or travel bans, have not worked in the past. And certainly there's no evidence to suggest that that will make a difference. What would make a difference is that at every border we institute vigilance, and that we screen individuals, we monitor them, and any traveler presenting to any healthcare service, that there should be an index of suspicion, and bloods taken and sent to the NICD in South Africa to ensure that the testing is done. And so that's what makes the difference.
Mm-hmm. So, two last questions then. In your capacity as the chair of the Africa CDC Emergency Consultative Group, you've been urged to urgently convene the ECG in order to provide what it's called technical guidance and recommendations on, just the evolving risk situation. What becomes the first order of business?
So this morning, the Emergency Consultative Group, which comprises 20 scientists from throughout Africa, we are public health physicians, infectious diseases clinicians, virologists, a whole group of individuals. And so on our call this morning, we received the latest data. And so we studied the epidemiology of the virus. We've studied how and been tracking how it's been spreading so far, what the case numbers are, what's the mortality rate, what's the diagnostic rate. So we've looked at all of that, and we are in the process of making a recommendation to the Director General of the Africa CDC. And our responsibility is to provide guidance to the Director General of the Africa CDC on whether to declare a public health emergency of continental security. In other words, is this a public health threat in Africa? And right now, when we look at the evidence, there's certainly a reason to be concerned, but there's every reason in addition to be reasonably confident that we can control it if we take the right steps. And the right steps right now are what we're busy mapping out and providing to the Africa CDC.
As a final one then, I'm smiling because I'm sure you know where I'm about to go. I'm reading a statement from the 14th of May from CAPRISA. It says, the Chancellor of National Orders announced today that CAPRISA Director and Clinical Infectious Diseases Epidemiologist, Professor Salim Abdul Karim, has been awarded the Order of Mapungubwe Gold by President Cyril Ramaphosa, the highest award bestowed. Let's talk about this. Congratulations, Prof.
Thank you very much. I mean, I'm so deeply grateful and honored to be receiving this order. I have to say, I never thought, I would ever be in this kind of situation. But I think for me, it's really not, this award is not mine. I'm part of a team of amazing scientists. And the whole team at CAPRISA, the researchers, the nurses, the doctors, the pharmacists, the patients who participate in our studies, the funders who provide us with support, our international collaborators in 250 different institutions across the world, they have enabled us to make a difference. And this order is recognizing that impact of that research. And for me, I'm particularly excited because at a time when science is being challenged, where we're seeing so much of anti-scientific sentiment, for our country to be recognizing science and scientific excellence, it speaks volume. And it's one more indication why our country is so great.
Might I add, the Order of Mapungubwe recognizes South Africans who have accomplished excellence and exceptional achievements to the benefit of South Africa and beyond. And a lot of us, of course, and even our viewers will agree that this is truly the work that you've done, even as CAPRISA, navigating us even through, for example, the COVID-19 pandemic, when a lot didn't make sense at the time. So, Prof, thank you so much, and congratulations once again to you and the team.
Thank you.
Thank you so much. That was epidemiologist and director at CAPRISA, Professor Salim Abdul Karim.